Good evening, my good people. It's my hope you have had a good day. Mine too has been one of the best. We are still on our topic about food poisoning, which branched to viral gastroenteritis. And in this video, we will start by talking about the complications which come about as a result of viral gastroenteritis. And before we continue, for those who have not subscribed, what are you waiting for? It's becoming more fun. People are enjoying this. People are benefiting from this. So let's subscribe, like, share, and comment on our videos so that they may reach as many people as possible. So, what are the complications which can come about as a result of viral gastroenteritis? The main complication is always, or the main complication which come about as a result of viral gastroenteritis is dehydration, which can be quite severe in babies and young children. Viral gastroenteritis accounts for over 200,000 gastroenteric deaths worldwide per year. We also have other complications apart from dehydration. Dehydration is the main one, but we have other complications which come about as a result of viral gastroenteritis, and these include, number one, nutritional imbalances. This is because of losing a lot of fluids, which brings about electrolyte imbalance and nutritional imbalances. We have body weaknesses. If you have diarrhea a lot and vomit a lot, your body becomes weak. And also fatigue or feeling of tiredness. The third one, we have what we call muscle weakness. A point to note, dehydration can be life-threatening. Call your doctor if you have the following symptoms. If you experience the following symptoms in your child or you yourself and you are having viral gastroenteritis, call your doctor or visit your doctor if you see the following. Number one, diarrhea lasting more than a few days. Number two, bloody stool or blood in stool. Number three, confusion or lethargy. Number four, dizziness or feeling like you are going to faint. Number five, nausea. Number six, dry mouth. Next point, inability to produce tears. That means the water levels in your body has gone down to an extent that you can't produce tears. Next point, we have no urine for more than 8 hours, which can be dangerous to the kidneys. Next, we have what we call sunken eyes. Next, we have sunken fontanelle or infants. In infants, sunken fontanelle in infants. Another point to note, dehydration that accompanies viral gastroenteritis can lead to several complications of its own. So there are some complications which come as a result of dehydration that accompanies gastroenteritis. So these are the complications of the dehydration itself, not complication of the gastroenteritis itself, but complications of the dehydration itself. Number one, we have brain swelling, which might be so dangerous because the brain controls everything in your body. So if it swells, it will come about with other complications. We have coma. We have hypovolemic shock a condition that occurs when your body doesn't have enough fluid or blood. As I had said before, kidney failure. We have also what we call seizures or conversions. Another point to note, to prevent complications, get immediate attention if your child has symptoms of dehydration. So if you realize these symptoms, make sure you get an immediate action. Take your child to the hospital, call your doctor or your healthcare provider if you see these symptoms of dehydration. So what are the treatment regimens, or how do you treat viral gastroenteritis? Mostly medical history and physical examination are the basis for diagnosis, especially if there is evidence that the virus is spreading through the community. Physical examination and medical history. If you give the history that you have been diarrheaing, feeling like vomiting, this can lead to a diagnosis of viral gastroenteritis. Stool samples may also help to test the type of virus or find if your illness is caused by parasitic or bacterial infection. As we discussed before, we have 4 bacteria that cause viral gastroenteritis. For example, rotavirus, adenovirus, retrovirus, norovirus, all those. So you have to identify the specific one that is causing the current situation. Is it a parasitic or bacterial infection? This marks the end of our first video today. And in the next video, we will continue discussing about how to treat viral gastroenteritis. So my people, continue keeping the support on. For those who have not subscribed, let's continue subscribing, sharing and commenting. And those who have given their topics to be discussed, as I have always said, it's not always easy to make these videos. So just bear with me, and I'm sure your topic will be tackled in a few days. So let's maintain the patience. So let's meet in the next video and have a good evening.